Well, good morning. Let me welcome all of you here to the National Academies of Sciences, Engineering, and Medicine, as well as those who are joining us on the web this morning to this workshop of the Roundtable on Obesity Solutions, the title of which is Current Status and Response to the Global Obesity Pandemic. We were established by the Health and Medicine Division, formerly known as the Institute of Medicine now, nearly 6 years ago. The purpose from the start has been to engage leaders from multiple sectors, from all of the multiple sectors we hope that are needed to solve our nation's obesity crisis. We've included from the start representatives of healthcare, academia, business, health insurance, education, childcare, government, media, philanthropy, and a diverse group of nonprofits. Through discussions, through our public workshops like this one, our publications, our 4 innovation collaboratives, the Roundtable aspires and hopes we are and will continue to be a venue for inspiring and developing the kind of multi-sector collaborations and policy initiatives that are necessary not only to prevent and treat obesity and its consequences, but do so across the entire lifespan. And we also hope to be a part of the solution of what we all know are obesity-related health disparities throughout this country, and indeed we believe today's program will show the world. The Roundtable's focus on the current status of obesity solutions and how to drive progress, highlighting promising multi-sector environmental and policy approaches and how to overcome the challenges and implementation and scalability today leads us to this particular program, a focus on the response of the world to the global obesity pandemic. I want to start by formally thanking the planning group and staff here at the National Academies. There is a formal planning process. The planning committee ultimately is selected by or approved by the National Academies and is designed in order to provide the kind of program you're going to hear today. Shariki Kumenika, Tim Lubstein, Rachel Nugent, Nancy Roman, are joined by their 2 co-chairs, well known to, as I think the whole planning group is, Bill Dietz and Chris Economos, who have been a part of the work of this roundtable from the start. Staff are L. Alexander, Leslie Sim, and Cypress Links. They are part of the staff of the Roundtable on Obesity Solutions, which I should note for the record and especially for the world, was just last week recognized by receiving the first ever Cecil Award awarded by the National Academies, in this case the first Cecil Award awarded to a team, to a staff group, the first ever awarded for the best in class. And we're very thankful for the work that our staff does all of the time, but it's nice to be able to recognize them and let the world know how good we know they are. The bio sketches of all the planning committee members as well as our speakers are in the materials that were provided to you. The goal, I think, is straightforward. We're going to examine the status of the global obesity pandemic and explore approaches aimed at managing the problem in different settings around the world, especially, we hope, in reducing disparities. 4 sessions. The first is to provide an overview of the state of obesity globally. Secondly, we're going to hear about global obesity prevention and treatment efforts that identify, promote, and monitor policy and systems initiatives, I should say, globally. Third, we're going to hear about the complexity of the global approach to managing the epidemic. And lastly, we will close with a discussion about the lessons of the global approach and what those lessons may be for prevention and treatment efforts in the United States. We hope we are always timely in our efforts. We think this particular session is especially timely not only because of the state of the world, but also it is National Obesity Care Week. And Thursday, October 11th, is World Obesity Day. The planets, we hope, are aligned for this meeting. We hope to encourage, enhance, and sustain action for partnerships and collaborations, and watching you gather here today made me believe that this is a group that knows not just this work, but each other well, and is collaborating now, and we hope and believe will continue to collaborate and perhaps enhance your collaborations going forward to end this pandemic. In this case, around the world. I have a great, I think, honor now to introduce in a formal way a person well known, I hope and believe, to everyone in this room. Christina Economos will be the facilitator of this first session. She is, again, the co-chair of the group that planned this workshop. She is the co-founder and director and vice chair of Child Obesity 180, where she's been developing, implementing, and evaluating, as well as working to scale high-impact obesity prevention initiatives, notably Shape Up Somerville, Live Well, and Change Studies. She is professor and New Balance chair in childhood nutrition at the Friedman School of Nutrition, Science, and Policy at Tufts University. I would now, in recognizing her, like to inspire you to give your first active welcome and recognition by standing and receiving Christina Okonomos.